Facebook something.
Yeah, I think we're coming to the group now. Good evening, everybody. Just bear with me a second. That's it. I have to mute myself in the group, or else I have feedback and I can start talking again.
Right,
Good. It's exciting. So this is the first Facebook Live of the new year with a guest, and I couldn't think of anybody better than my dear friend Robert. Great to see you again, Robert.
Thanks very much, Andy. Lovely to be here. Lovely to be the first of the year.
Yes, and also to be the interviewee, because of course you've come and done some excellent interviews in the group last year, and they were some of the highest viewing figures actually for the group, which is really great. Looking at all sorts of things. Great to have you in the spotlight. Hi Ingrid, hi Victoria, hi Zoe, hi Jane Arden. Of course, that was a great conversation. That's one of the high ones actually. You and Jane, that was an amazing one. In the group, do check that one out, everybody. Hi Darren, hi Darren. They're all coming. Angela, hi everybody. Yes, so welcome. I must say, very quick thank you to Linda Michaels for my new hierarchy of dog needs. Nicely put on a canvas there, which Linda, something you can get that from the hierarchy of dog needs shop. And I'm back home now in Dog Centre Care HQ. So no chance of getting interrupted by the Afghans now, Robert, because they're somewhere else. The Afghan hounds, that is. Great, good. Well, Robert, great to see you again. Thank you for coming in. And this is going to be a good one tonight, I think. And we wanted to think about the effects of kind of emotional triage, if you like, or the kind of effects on when we think about trauma more widely, and especially the effects of medical interventions on physical and emotional trauma, and how everything truly connects all together. I'm going to share in the group here. Shall I pop this in now, Robert? Do you want that?
Yeah, do. We'll come to it fairly soon. Okay,
I'm just going to pop an image in the group chat here. Will that go in there? Oh, I don't know. Hang on a second. No, I haven't. Let's have a look. Can I put that in? How do I do that?
We'll just drag it to the live feed. Drag it to the top of the Facebook page.
Yeah, oh, there you go. Copy. It won't go in there. I don't know why it's not going into the comment section. Hang on a minute. Bear with me a minute, because I'm on here. How do I put something in there? That might be a bit tricky. I can't put it in for some reason. I don't know why it won't let me put a comment in with a picture. Okay, I'm going to pop it. Where should I put it? Shall I just put it in the group for a second? It won't mean anything to anybody in the group, but I shall put it in the group.
I'll try and drag it in from here if you like.
Yeah, I can try it. Yeah, I can't put it into the chat though, the live chat for some reason. Let's have a look here. No, I can't do it. Okay, no problem. I'm going to bring it up on the screen, I think, initially. Robert, I think I'll just do a share screen very quickly.
Okay.
And then people can see the image. I'm going to share an image. We're going to put this into the files section. I think that's the important thing. There we go. Right. So that should be there now. There you go. Good. The ABC of canine emotional trauma. Hopefully everybody can see that in the group.
I'll turn my Facebook thing off, yeah? It's that. That.
Good.
You back again?
Yeah. People can see that in the group. I can see that. So I'm going to make sure we pop this into the group, Robert.
Right. Can I get rid of the screen? Oh, that's it. I've got that away.
Yeah, so I've shared it. The people can have a look at it, have a little look at it, take a picture of it, visualize it. That's the picture, the ABC of canine emotional trauma. We're going to go through this a little bit. I can't copy it into the chat, sadly, but we will pop a copy of this, if that's all right, Robert, into the file section.
Yeah, that's cool. That's cool. Yeah, it should just go on there. It's only a ping file.
Yeah, brilliant. I'll ping that.
Okay, well,
right, so let's stop the share, then I'll stop that share screen. We'll come back in the room. That's normal.
Okay.
That's there. Great, good. Okay, Robert, let's get started then. So,
righty-ho. Okay, so I think we've kind of recognised for a long time that the dogs have been set up to fail. going into training classes, going into veterinary centres, etc. Basically because we take them into stressful environments, there's full of smells that they don't like, they're not familiar with, particularly for pheromonal type smells, which are danger signals. We've got sweat, anal gland material, urine, feces, vomit, estrus dogs all over the waiting room, smell of blood, pus, it's all there. And, you know, on top of that, there's the visual cues. And veterinary profession's actually gone a long way in trying to resolve this. There's been a lot of push into trying to give vets resources that they can use, lots of education, lots of CPD every year. At all the conferences, there's always something going on to really help them support the dogs. But the thing is, it's the problem with it is that it's really talking about dogs as a thing rather than dogs as individuals. And it's putting an awful lot of responsibility onto the veterinary profession, and we can include in that the grooming profession as well. Anybody who handles dogs in a professional capacity, which I guess includes behaviourists and trainers, etc., etc. So the idea of tonight was to bring together some of the things that I've been working on over the last few years, developing tools using personality in dogs. We released our first tool in 2021. We released the cat one in 2023, which is what I was doing in Denmark. And we've got one for horses in the pipeline coming in later on this year. So we've now got through sort of 3 species in the bag. And all this is based on personality. And it was the work I was doing on personality which kind of drew me into the literature of which then brought to mind the idea of having some kind of emotional triage. So in terms of humans, I think everybody knows what triage is. It's basically the ABC of the first things one has to do when one is confronted with a trauma patient, which is basically airway, breathing, circulation. There are other bits that you add on to that. But I think what I've done is kind of adopted that very simple framework. What I'm going to do here is give you a kind of very hand-wavy version of it. There's a much more complicated science version with all the evidence and the neuroanatomy and pharmacology that go along with it. And that perhaps is a story for another time. But I think just to give you an overview of what this thing does and what it's capable of doing, and giving you some tools that you can take home, hopefully, and start using tomorrow by the end of this hour. So let's dive in, and I will explain. I don't know if you managed to capture that graphic at all, or if you've got good memory. But basically, it is a triangle with B at the top and A on the left-hand side, C on the right-hand side. It's an equilateral triangle. The B obviously stands for behavior. The A stands for affect, and the C stands for cognition. So we've got cognition, which basically is the dog making meaning of what's going on the outside. We've got affect, which is basically emotions. And we've got behavior up the top. Now, the important thing about this...
I popped that on the screen at the moment. I've shared
Brilliant.
the screen. Just for a
okay,
second.
well, I've kind of lowered it down to my corner so I can still see you.
Yeah.
But providing it's not blocking us off for the rest of the audience. I don't
know.
No,
everybody can see fine, yeah.
Oh, brilliant. Good. So the circle of arrows going around it basically represents that between behavior, cognition, and affect, i.e. emotion, there is no beginning bit. There's no beginning, there's no end. This is a continuous clockwise circle that goes on forever. So nothing comes first. I'm not suggesting that behavior comes first, or affect comes first, or cognition comes first. Because it's a circle and it's constantly rotating round, one is simply going from the other. So we're going from cognition to affect, to behavior, to cognition, to affect, and behavior. And where you jump in on that really doesn't matter. The point here to make is that we've got 2 kinds of circle here. One is a virtuous circle, which simply means that everything's going well for the dog. Their caregivers, their guardians, etc., are doing the right thing. They're having good experiences of veterinary practices. So they're able to cope with their emotions, if you like. Their processing of their experiences are good. They behave in an appropriate manner, which then feeds back into the cognitive side, which gives them meaning making of, yes, things are going well. The other side of that coin is that if things aren't going well, this circle then turns into a vicious cycle. And I think
Mm.
this is a really nice metaphor to use if one is explaining this maybe to caregivers, to guardians, to other professionals. As I say, there's a lot more that goes into this in terms of neuroanatomy and everything else, but I think this, as it stands, is a really good metaphor to explain this. That kind of wavy, squiggly line at the top, that blue line, represents traditionally what we see as behavior up the top, which is basically the tip of the iceberg. And everything else going on underneath, which we tend to forget, is this cognition and this affect bit. Obviously, what this does is then bring into the question two other factors, which are the resilience and the vulnerability of that particular dog. So we might call this the susceptibility, if you like. And what those two factors have in common, or at least what they're driven by, is firstly genetics, which of course we know, which is good old nature, and then also the history, the life history of that dog. So this is experiences from puppyhood, medical history, chronic diseases, etc., etc. It's the kind of full gamut of the dog's life experiences from the time they were born through to the time they die. One really important point to make here, before I forget, is that when we're talking about behavior, we tend to think we're referring only to the obvious extrinsic behaviors, the yawning and the yapping and the barking and the wagging tail. But it's really, really important to remember that behavior is also intrinsic. So we're talking about the behavior which arises from the sympathetic and parasympathetic nervous systems. This is the visceromotor systems. And of course, what they're driving are the smooth muscles of heart, controlling heart rate, gut motility. Dogs have lots and lots of gut problems when they have behavioral problems. Respiratory rate, glandular secretions. So we're talking about secretions from adrenal cortex, adrenal medulla, stress hormones. So all these things need to be taken into account when one is considering that factor, that B factor, at the top of that graph. So it's all very well to talk about these things. It's all very well to come up with these categories and names and so on and so forth. But the big question is how we turn this into something which is practical. And as I said, I came into this from the personality side of things, and I could go into the different personality types of dogs, the different personality scales that have been born, etc., etc. But you can look that up for yourselves. But one of the things that I came across when I was doing this work is some research done by an Elaine and Arthur Aron in 1990s around sensory processing sensitivity. And what this is a subtrait of personality, as the authors describe, which describes certain kinds of people which tend to be more sensitive than others in terms of sensory processing. And this really fits really well now in what we call neurodivergent individuals. So I think we didn't have that term back in the 1990s, but certainly in the literature now, this is now recognized as a category, within the neurodivergent spectrum. And then a little bit later than that, in 2017, another bit of work I came across by a veterinarian in Switzerland called Maya Bream, is a piece of work which extended the work of Elaine Aron and basically looked if she could find the same things in dogs. And she called this the highly sensitive dog scale. And if you have a look up on Google, the highly sensitive dog questionnaire, you'll find that these are knocking around in various kennels and rescue places. It's a piece of work that hasn't seemed to have attracted much attention. I'm quite surprised to see. But I think it's actually quite a good piece of work. There's quite a lot of speculation in there. But nonetheless, I think there is mileage to be made out of this. And this is really the basis of what I built into this emotional triage thing. So the question here is, what makes one individual react more strongly to a particular situation than another? And again, it comes down to this idea of vulnerability and susceptibility, which of course are genetic and experiential phenomena. So from the human literature, what we know is that more highly sensitive children, i.e. on the sensory processing sensitivity scale, more highly sensitive kids who grew up in negative environments, unsupporting parents, and so on and so forth, tend to be more susceptible when they mature as adults. But I think one really interesting thing from the literature is that when we look at highly sensitive kids whose environments are really supportive, they have good schooling, they have great parents, everything goes well for them. When they grow into adults, they actually thrive better than the comparable kids who are less sensitive on, than who are on the sort of less sensitive side of that scale. So for me, the takeaway here is that there must be some kind of evolutionary reason why we have those sensitive individuals. It's not that there's some kind of weakness. It's actually a strength, but it only becomes a strength when it's well supported during those early years, those developmental years. And I think this feeds really well into the, what we do with puppies, what we think about doing with puppy classes, which we can talk about a little bit later on, Andy.
We pause on that a second because we actually our next speaker coming in, Rachel Michaud, is an attachment expert with kids, and I think this is really resonates with that. And so what I'm hearing you saying there then is it's almost like that element, that extra level of sensitivity creates potentially more awareness and the ability to take in information and to make the most of that and have it as a positive thing. That foundational safety has to be really important to kind of compensate. I guess the worst case scenario is to have that potentially insecure attachment base and be really aware and be really sensitive and not have that safe grounding. I guess it can go one way or the other.
You're really set up to, you're kind of set up to fail, and there's kind of nothing new here. We always know that a good start in life sets you up good, but it's nice to actually have some numbers on it. Now, what we don't have are many numbers in that have been studied in the same kind of way, i.e. from the point of view of sensory processing sensitivity in dogs. We can only kind of extrapolate that we know dogs that are brought up in fairly rough environments. We know with that big study that's just been released on COVID dogs, the kind of behavioral problems we're seeing in them. So we know that this seems to be the same trend, but what we haven't got is the studies to support it. So I think there's a PhD there for somebody to take up at some point. And, maybe Lorna Winter might speak to Daniel Mills at Lincoln about that, because there are some ideas that we're knocking about with her Zigzag app.
Yeah, and I think when you think then about the pressure we put on from like you said, an extrinsic point of view with our focus on predominantly training and structured learning, when you have a young brain that is already being processing the world with slightly different filters, you can see where that mismatch can cause problems actually quite early on.
Yeah, exactly. But one of the things that has fallen out of the dog work is that we know that there is an interaction between the sensitivity of a dog and the sensitivity of an owner. So if both are higher up on the scale, or one is high up and one is low down, does seem to be some kind of interaction. And so what we know is that the greater the difference between the sensory processing sensitivity of the owner and the dog, the more behavioral problems are reported. And this is some of the work that dropped out of Mayor Bream's study. So, and the converse of that is that when the sensitivities are matched, then they seem to report fewer behavioral problems. Now that's interesting because it might suggest that if the sensitivity of both human and the dog are low, then they're not going to be so affected. But when they're high, the owner is much more tuned into the dog's needs. That's
the key, isn't it? That's the important bit.
Yeah.
And actually then you have a scenario then when you have that mismatch slightly with the sensory processing needs, surrounded by a kind of general theme for the general public about compliance and obedience. It's no wonder a lot of friction comes along, and some of that secure connection that's really needed as part of that relationship starts to ebb away, really. And we know that's a root of many behavioral challenges, actually, because you end up with a dog or the human feeling they have unmet need and get frustrated and everything else that comes with it, I guess.
Yeah. And interestingly enough, you mentioned kind of punitive training techniques, positive punishment. One would assume that if you have a sensitive dog that's positively punished compared to a non-sensitive dog, then the sensitive dog's going to be affected more. The strange thing is, it isn't. They're both affected by the same amount. So it kind of shows the power of positive punishment here. It seems to bypass the fact of whether, it seems to bypass the necessity for a dog to be sensitive to react badly to positive punishment. So, all dogs seem to react the same way. And I think that's a big message to take home for avoiding positive punishment at all costs. That affects not just sensitive dogs, but dogs on the low sensitivity scale too.
Yeah, and that fits in again with this thing that it really does damage those attempts to find secure attachments. I think this is something that, because that's what a primary goal for that young dog's brain, just like it is for young kids' brains, I think. Okay,
Yeah.
great. Okay, that was a good little segue there. We'll get back on it then, Robert, back on to as you take us through this.
Okay. Interestingly enough, there is also something that falls out with negative punishment. And as far as high sensitivity dogs are concerned, they react much worse to negative punishment than the low sensitivity dogs. So negative punishment being withholding of expected rewards. It's the whole thing behind clicker training, isn't it? You withhold a reward, you withhold a reward. That, in inexperienced hands, is not a nice thing for a high sensitivity dog. And it comes down to what you said, Andy, where these dogs don't cope well with uncertainty and lack of information. They need really clear guidance and time to process information.
And that really ties in with some of the with what we think about regarding predictability, that brain, those seeking circuits having that outcome.
Exactly.
Yeah. Okay, great.
And
thank you.
From this, what seems to fall out is that one can tease out 4 critical sensitivity factors, which seem to be playing a role here. We talked a little bit about information, we talked about sensitivity, but there seem to be sensitivity to 4 particular things. One is sensitivity for information, which we've kind of talked on briefly already. Another one is sensitivity to arousal. So this is how dogs react in that kind of amygdala-driven way. The third one is sensitivity to valance. So this is about emotionality, feeling, affect. And the final sensitivity is sensitivity to sensory perception. And that's quite a big one. And we'll come back to that in a little bit more detail later. So the sensitivity of information basically is about information foraging. So more sensitive dogs process information coming in from all senses, i.e. interoception and exteroception. We always tend to think of incoming sensory information to be exteroceptive only, eyes, ears, nose, touch, etc. But of course, you have to remember that the dog is also perceiving a lot of information from its guts as well, from the viscera, heart, blood vessels, the glands. Those interested in polyvagal theory, your ears will kind of prick up with this one as well, because that's where this comes in, and the idea of trying to modulate the parasympathetic nervous system, the vagus nerve, etc., by downplaying the sympathetic side. It seems to be that the way that high sensitivity dogs process information is beyond simple stimulus response, which is often the kind of sign tracking that we see in dogs that are less sensitive. They just follow the cues. The more sensitive dogs seem to be more cerebral, if you like. They seem to take time to process information. They like to process information before they act. They do a lot of stopping and watching. And all these things, again, are what seems to have come out from the personality scales, which Myra Bream looked at when she was developing her high sensitivity dog questionnaire scale. And I think what this does is bring me around to thinking about Laura Donaldson's work with her slow thinking, and perhaps Sarah Fisher as well with her ACE work, where you're kind of giving the dog space and time to think. So I think that kind of gels in quite nicely with this idea of sensitivity to processing information. What does this mean in practice? Well, I think it reminds me of getting really angry when I see people walking around using their mobile phones all the time and completely ignoring what their dogs are doing. We live in a horribly chaotic human world. Things seem to move incredibly fast for us. A million times to think about it once, social media, getting to work on time, etc., etc., etc. And I think it's really important that guardians really remember just to slow down a bit and give these high sensitivity dogs. They can do the scoring for themselves on the questionnaire. Really to give the dogs time to process information, give them breaks, be very aware when the dogs start to climb Kindle Shepherd's ladder of aggression, stress yawning, slowing down, panting, refusing to move, and then going up the ladder to being perhaps more reactive around other dogs and so on and so forth. So it's all about giving dogs time, and particularly this applies again to the veterinary practice, planning ahead, maybe meetings in the car park, so on and so forth. So moving on to factor two is sensitivity to arousal. As I said, this is really about the quick reaction from the modulating frontal cortices, where you're processing information, you're making meaning of things. This is the cognitive part of sensory processing, to jumping too quickly to the salient-seeking amygdala, the reaction, the hypothalamic pituitary adrenal axis activation, and the kind of typical stress response. And again, this brings me back to the idea of negative punishment, exteroception, and also interoception. And I think there's been a lot of talk about things like referred pain, gut feelings, gut sounds. All these things can be arousing for these kind of sensitive dogs. They tend to expect the worst, and so they quickly become sort of overwhelmed, and stress really becomes maladaptive to them. And of course, we need to remember that there are two main neuroendocrine regulators here. These are homeostatic regulators, which is the HPA axis, which I've mentioned briefly already. And of course, the sympathetic adrenal medullary axis, which causes the release of catecholamines, which are adrenaline, noradrenaline, and of course, dopamine, which is a derivative of noradrenaline. It's actually synthesized from noradrenaline. The third sensitivity factor is valance. So this is about feelings, about emotions. And remember, valance has two scales. It's got a scale of feeling good to feeling bad, positive, negative, and also a scale of intensity, how intense that is. Sensitive dogs appear, according to the studies that we've got, to be much more aware of their own emotional states. And they're also more sensitive to perhaps picking up our emotional states as well, the emotional states of their surroundings, the emotional states of the veterinary professionals handling them, the groomers, the emotional states of other dogs, maybe other dogs in a waiting room, a busy waiting room with the smells and body odors, etc., which I've talked about already. And also remember, they pick up on an anxious guardian, an anxious veterinarian, perhaps more so than a sign-seeking, less sensitive dog. Remember, the sign-seeking, less sensitive dogs are perhaps more cue-driven. They're much more interested in the smells and the sights in a waiting room than the more sensitive dogs, who are trying to weigh things up and make meaning out of what they're seeing and what they're perceiving. So it's really important that we, as guardians, as canine professionals, also remind ourselves that we need to briefly stop and watch the dog too, if they're a particularly highly sensitive dog, just to make sure and check in with them that they're still sort of within their limits of arousal, within their not sort of out of their arousal zones. So personality subtypes, I think, come into play here. If you go and have a look at some of the personality scales in people, sociability, playfulness, chase proneness, aggressiveness, etc. Like humans, these subtypes of personality tend to interact with each other. And if we're of a vulnerable type, then in the human phenotype, this tends to gel in, or at least link in with states like anxiety, depression, compulsivity, self-harm, etc. And if a dog is showing any of these kind of maladaptive signs, like self-harm, chewing, becoming too reactive, there might be a place here to think about preemptively using psychoactive medication. And there are lots of medications that can be used either on a long-term basis or short-term situation, specifically planned for a particular veterinary visit. I'm not going to talk about pharmacology here at all, but there is plenty of literature available to vets about the kinds of combinations that they can use, often dosing a medication the night before, another dose the morning of going to the vets. And the results that we find with that are that we get a very calm and relaxed dog, not a sedated dog, not a dog that's been compromised in any way, but a dog that's been slowed down enough. The reactivity's been slowed down enough to help them actually process the information, the new information around them, and make reasonable meaning of it. So it's actually an aid rather than something to kind of sedate them and sort of knock them out completely.
That's a good point on that. Could I just say, because
yeah.
I think a lot of people misinterpret, especially the psychopharmacology, that is somehow, like you say, a sedating effect. In fact, it just, with a lot of these dogs, it helps them to, like you say, process better and be more available and be more present, which is a good thing for them to regulate better themselves, actually, rather than be the opposite, suppressing them.
Yeah, well, what it's doing is basically suppressing the stress response.
Mm.
So it's dampening that down, and so in effect, what it's doing is increasing the threshold of the stress response in these arousal sensitive dogs, and that's a good thing. So the fourth sensitivity factor is sensory perception, and what this factor is doing is weighing up the balance between, again, exteroceptive and interoceptive sensory processing. So we know from the literature that less sensitive dogs tend to be more attentive at least, and sensitive to primarily exteroceptive signals. So again, these are the dogs that tend to be sign seekers. They tend to be the dogs that go on sort of following cues. So it's about smells, it's about noises, it's about interesting things over there in the corner, it's about touch. Whereas the high sensitive dogs tend to be more attentive to both the exteroceptive signals, but also what's going on in their own bodies. And again, this brings us back to the idea of the viscera, polyvagal theory, what's going on in the gut, what's going on in the heart, increased heart rate, increased blood pressure, etc., etc. And what all this means is that these highly sensitive dogs are more sensitive to really small things that we wouldn't notice, such as a subtle pinch from a nerve in a leg or something like that. A little bit of discomfort, slight discomfort, a bit of itch. Physiotherapists would talk about sensations in fascia, trigger points in muscles. All these kind of things are important, and all these things are the kind of things that mean more to a dog that's high on the sensitivity scale than they would to a dog that's actually much lower down, who is much more cued up to the exteroceptive signals. In these highly sensitive dogs as well, we need to be thinking about perhaps slight changes in perception. So, for example, dogs that are prone to having seizures. Some seizures can be very mild. So we talk about focal epileptic seizures, which are more like sort of fairly mild hallucinations. I guess one incarnation might be of dogs that maybe occasionally fly snap or something like that. Not as a compulsive behavior, but dogs that do it occasionally. Owners report it maybe doing it once or twice in a month. That might be something to do with a very transient focal epileptic seizure. Then there are things like low blood sugar, low thyroid hormone, so hypothyroid dogs, or maybe dogs that are stressed. Stress itself reduces the level of thyroid hormone. So, it's very sensitive to stress situations. Low blood cortisol, high blood cortisol, all sorts of things can have that kind of effect, which these high sensitive dogs are going to pick up almost as sort of ghostly things that we simply can't recognize from looking at them from the outside. I've already mentioned things like noise from the gut and so on, things like borborygmy, grumbling stomach. All these things make a difference. We don't know whether dogs have hot flushes or cold flushes. They probably do. Do they feel kind of sweaty and clammy like we do sometimes when we're stressed? We tend not to think about these things, but I think all these things need to go on the list. And the interesting thing here is that we know that low sensitive dogs really don't notice any of these things. As I say, they're more cued up on the exteroceptive stimuli. So what this boils down, sorry, Andy.
I was just going to say, so it's almost like some of these highly sensitive dogs, then some of those dials are just really tuned in high.
Yes.
So they're tuning into specific things. And this ties in a lot with that excellent chronic pain series you did just before Christmas.
Yeah.
And about understanding how important it is to really understand the individual dog. And I think there is a risk, isn't it, that it's like, oh, well, I don't think that's painful. Based on what? Because it could be extremely uncomfortable for one dog and not compute for another necessarily.
Yeah. And I think the key point here is that, and if you remember nothing else, what I would like you to remember is that it's not just taking any one of these factors into account. One needs to take them all into account. So we're talking about sensitivity to sensory processing. and the idea that these high sensitive dogs are more sensitive to these interoceptive cues if we are managing the other factors as well, i.e. the information processing, a really important one, giving them time to do that, the arousal processing, the valance processing, and the sensory processing itself. If we're managing all those well, then going back to our emotional triage diagram, that virtuous circle remains a virtuous circle. It doesn't become a vicious cycle. So this is the point. It's not taking any one of these things. It's thinking about all of them as a whole, which is why I've divided them up into these 4 separate factors. And if you tick all those boxes, then there's no reason why a high sensitive dog really shouldn't thrive just as well as a low sensitivity dog. It's just that they're able to manage their interoceptive feelings, if you like, much better. They make meaning of them in some way that they wouldn't be doing if they were in the vicious cycle sort of phase of the emotional triage. And I think what this helps explain is why sometimes vets are challenged with really puzzling kind of behaviors in dogs, where the owner will go in and say that, you know, my dog is a little bit restless or limps a little bit, or is suddenly becoming sensitive to sounds, or doesn't want to go out for walks anymore, reluctant to go out in the garden, starting to pee on the floor, starting to defecate on the floor at night. All of these things are sort of difficult to explain. They suddenly occur, they're difficult to explain. We tend to put them down as a behavior problem if we can rule out any kind of medical causes. But what we're probably dealing with here is a dog that's high on the sensitivity scale, but for one of these factors is not able to process it properly. So, you know, the way to tackle that is not as a behavioral problem, not as a medical problem, but actually to go back and have a look within the dog's history of how we're managing you know, these 4 factors for this particular dog. And I would argue that we will find the answer there much more quickly and much more cheaply than we will in lots of behavior work, lots of medical examinations, lots of blood tests and all this sort of thing.
So it's to avoiding the kind of temptation to pathologize something necessarily straight away.
Yes.
And to think about it just as that individual dog and how they process and cope with the world intrinsically and extrinsically around them.
Yeah, and I'm hoping these 4 factors, looking at it from this sensitivity scale point of view, it gives behaviorists, guardians and veterinarians another tool for the toolbox. So rather than just thinking of behavioral problems as we classically do, and anxiety or sensitive dog as a single entity, go back and work through it using these 4 factors. And I think that's where this triage diagram comes in, because it helps explain to a guardian, to a veterinarian, to a groomer, to a behaviorist, how one can kind of break these things down and analyze them with a kind of simple metaphor. That make sense?
Great. Yes, completely. And I think
I'm trying to give pause so you can put some feedback in.
no. I just like you to it's really compelling, and I'm sure a lot of people a lot of this will resonate either with their own dogs or with clients' dogs, or that dog that you saw before that you weren't sure you're missing a part of that jigsaw. And I think even this thing about this notion of the internal sensations regarding, you know, and how our visceral systems work and how they behave and what that does for us and how we're affected by different things. It's really important for us as we try and join the dots for that individual dog's emotional experience. Yeah. And especially when we add in extra aspects, because part of the topic today obviously is thinking about the emotional and physical trauma that comes from other kind of things that go on with the dog, even things that might seem relatively routine, especially from a clinical kind of support point of view. Yeah,
and I think one of the classic things we see in dogs, or one of the classic things that seem to be reported, are these chronically affected dogs with these gastrointestinal upset things, where they keep having the soft stools, they keep having the wind, and wherever you feed them, they've always got these ongoing intestinal problems. They're probably highly sensitive dogs that are highly tuned into their guts. They simply keep getting all this feedback, which is then pushing them into this sort of vicious cycle of making bad interpretations of what they're feeling. And then that triggers poor emotions, which can trigger inappropriate behavior, which triggers meaning making in a negative sense. And so the thing goes round and round and round, and that's why these things keep recurring.
Yeah.
But I think from the point of view of managing these, I guess one thing one could be looking at in trying to manage this as a whole is thinking about taking Sarah Fisher's work again, talking about, promoting relaxation, physical touch therapies. A lot of these dogs seem to be fairly tuned in to being touched. Again, it's an exteroceptive, proprioceptive modality. So physiotherapy, maybe osteopathy, acupuncture, Ellington touch, all these kind of things, Bowen, canine Bowen techniques, and so on and so forth. If a dog is tuned into that, just bearing in mind that some dogs don't like being touched, and we know who they are. They are the ones that kind of cringe for whatever reason, and that's just how they are. So this kind of thing isn't quite so appropriate. So for those kind of dogs, maybe thinking about relaxation, relaxing odors such as Pet Remedy, plugins, valerian, vetiver, clary sage, basil, and so on. Lavender cushions, essential oils, maybe. Dog friendly sensory gardens, zoo pharmacognosy, something like that. All these things I think are worth thinking about. Calming music, calming sounds. There's some work on using classical music in veterinary settings and so on and so forth. It might work for some dogs, I don't know. Or just calm, not doing anything. Having a duvet day on the sofa with a dog, not interacting too much, just letting them interact with you. I think all these things are kind of helpful, anything that works for the dog. And then maybe thinking about coming back to puppies again. This idea of group play really needs to be carefully monitored. I've mentioned Lorna Winter already with Zigzag, and the idea of maybe personalized management of puppies, puppy socialization, the kind of stimuli one might use. In highly sensitive dogs, perhaps too much at a time is just going to be too much. It's going to be counterproductive. And these dogs are going to learn to be reactive. You're going to push their virtuous circle into a vicious cycle very, very early on, and then that's going to be their go-to coping strategy. And I suspect that's at the root of what we see in a lot of these dogs that have a not very good upbringing, and then become really quite sensitive and reactive dogs as adults, and that's very, very difficult to fix.
Yeah, and even in quite a supportive home, but a home that doesn't understand their dog in front of them. And
yes,
I did a live in the group about,
yes,
you and I discussed this before, this notion of processing, engagement, and exit, and using those three things as feedback. And I shared a video clip of Molly when she was a puppy, showing me what was her sensitivities in the environment regarding what she needed more time to process and that kind of thing, because it was very Molly led then, and I could get that feedback. And what's also interesting what you're saying, Robert, is a lot of things you've discussed here, people see as kind of add-ons or almost complementary stuff, but actually it's really foundational for a lot of these dogs to have that approach. And it highlights very clearly why the traditional notion of seeing the behavior as something that has to be changed is really problematic on its own, because there is no one size fits all. A lot of these behaviors, a lot of the dogs I work with who struggle with the social environment, for example, underneath it all, there is something else that's happening that's stopping that system to be in the right place to think, now I have the capacity to deal with social stuff, because obviously social stuff takes a lot of juice. And even for us, if we're not feeling great, our bandwidth for anything social is really compromised anyway.
Yes.
And we could be doing a lot of stuff, even with positive reinforcement, that still isn't providing that relief that the dog's system needs, or giving them the time they need, or addressing some of these sensitivities that you talk about in those 4 different compartments for 4 different places.
And I think Jane Arden has a lot to say about puppies too. She's been very observant into what she's seen with her own puppies, and how they behave as youngsters does seem to manifest itself as how they behave as adults. And perhaps we could have Jane back on here at some point to talk about these things a bit further.
Yeah, well, Jane will be great. Yes, anytime. So what I'm hoping for caregivers who are listening now, as well as professionals, is a lot of members in the group, Robert, as you know, are caregivers, and they've been down the train more route, and then they feel they've got into a bit of a cul-de-sac. And then listening to these kind of conversations make them think, oh, well, maybe there's something more I need to consider here about my individual dog's lived experience. And if that system isn't in a relatively foundated place, our ability to cope with other stuff really does start to get compromised. We can all experience that, even if we're not feeling very well or we've got a bit extra stress, let alone some of this intrinsic stuff that you're talking about, those extra being more sensitive to things. And it must be hard for some of these dogs. There's almost an element of sufferance, Robert, because from a young age, they're trying to say, look, I'm struggling with this bit of the world, or I'm struggling with this thing that I feel because I'm very sensitive to it. And they're having to find these ways of navigating through these things, and they don't have enough agency to do that, do they?
Well, I think it digs a very deep furrow. That's the problem. They really do get stuck in a rut, and it becomes a coping strategy that works for them, and that's how it kind of stays. And it's really difficult to shake them out of that. And I think the high sensitivity dogs, the rut gets dug much deeper, as it were.
Mm. Yeah, because just like with humans, I guess, a lot of the coping mechanisms and strategies that we end up being forced to adopt are often inappropriate in the widest scheme, but they're the closest thing that you have, dog or human, to getting some of that relief, I guess.
Yeah, exactly. But I think another interesting connection that comes out of this work is, you know how we're familiar with the idea of body-mind connection and all this kind of stuff in humans. And for many, many years, we've talked about the idea of these psychosomatic illnesses, where people have these pains or these fevers or these acute tirednesses or whatever it happens to be, which seem to have no physical cause. And doctors just put it down as a psychosomatic illness. It's all in your head kind of thing. And in dogs, we've had a parallel thing. This idea of psychogenic polydipsia, labeled as a psychosomatic condition, i.e. there's no physical cause, it's all in the dog's head. But I think certainly in the last 5 or 10 years, there's been a shift in the way medics think about this. I've spoken to a lot of psychiatrists and medics on this, and neurologists who've been actually trying to work together more recently and trying to solve this puzzle. In the past, it's always been something where neurologists sign a patient off as having no lesions, and therefore it must be in their heads. And the psychiatrists going back and saying, well, it can't be, there must be more to it than that. And I think there's now been almost like a truce between the two warring sides, where we've now got these conditions, these previously called psychosomatic illnesses, as dysfunctions of many systems, i.e. the psyche system, the neuro system, the endocrine system, and the immune system. And there is some empirical evidence to support this now. And again, all these things seem to be triggered by trait anxiety or trait vulnerability. And therefore it comes back to this idea of chronic stress and chronic physical illness being somehow linked. And the thing is, we know already that we see this in dogs too. We've always, what one would imagine this is a purely human frailty, but we see it in animals too. And the classic example I always cite is feline idiopathic cystitis. So anyone who has cats, or any veterinarian watching this, or any clinician or veterinary nurse watching this, will be very familiar with cats that get cystitis for apparently no reason. It's a stress-related cystitis that is recognized now as. And I think these kind of stress-related chronic diseases are probably more common in dogs than we realize. The only one we have for dogs is sort of psychogenic polydipsia, drinking far more water than they actually need. It's a dysfunctional consumption of water. But I think in the kind of plethora of diseases we see, for example, immune-mediated diseases such as immune-mediated hemolytic anemia in dogs, which is one of these spontaneously occurring nasty diseases where they start destroying their own blood cells. Often there's no cause identified, but there's never been any work to see if there's any link between incidents of that and or at least prevalence of that within the population, and linking to the high sensitivity scale of those dogs. So that's, again, a nice piece of work that could be done. And also intestinal diseases. You know, we talk a lot in the behavioral world about these dogs with dodgy guts. They've always got diarrhea, they've always got constipation, they've always got wind. There's always something wrong with their guts, which then brings us back to this interoception thing. We haven't even started to think about diabetes, kidney disease, heart disease, all these chronic conditions over time. If these are related to inflammation into endocrine vulnerability, let's say, that are brought about through chronic stress, hypothalamic adrenal axis sensitivity, and so on and so forth. All of these things are unexplained, and the links there have not yet been studied in dogs. But I think we have to consider the case where that's the case, and certainly in chronic pain conditions, we know that many chronic pain conditions in people are actually undiagnosed. You can't find anything, no signs, there's no lesions, there's nothing on MRI, there's nothing on CT scans, nothing at all except the patient's testimony that they feel pain. But we know pain is, you know, very closely linked to emotional states, and therefore that, you know, the high sensitivity of the dog. Therefore, I think that there's much more to be uncovered in that over the years than we know now. And I think we just have to assume that these things are true, and this is the case.
I love what you said about there being a bit of a truce with some of the different camps, thinking, okay, hang on, we've got to stop fighting our corner and think, let's see if there's an area in the middle that we can inhabit, because maybe that's it. And this is always the challenge, isn't it, I think, Robert, because I kind of see our system as like a lot of dials and knobs and kind of gauges. And when it's working well, you know, everything's there, but one thing gets turned out a little bit, and then the body wants to get that balance back right. And if we're in a relatively stable place, it can do that with the kind of homeostasis process, whatever's going on. When you have a lot of things going on, and you have a lot of the compensatory things and all the different things that go on, and then add in the emotional side of things and how sensitive you are anyway, all these things, each individual one of us is an individual laboratory of our own.
Yeah,
and that's why I think science can struggle to say that's it, because your experience could be different to mine, and what it's done to your internal organs, and how different things have overcompensated, and how the endocrine system is kind of working comparably. And I think so that's where it can get tricky, isn't it? And that's why we need to have a lot of different disciplines coming together to think about some of the potential shared routes of some of this information.
Yeah, but I think what the analogy I like to give people as far as things like arousal are concerned and susceptibility is, if one thinks that all of the neurotransmitters in the brain have their own arousal level, and they're all different and they all work independently, but they're linked. And so the brain's job to keep the dog on the virtuous circle rather than the vicious cycle. A good analogy to think about is if you're trying to hold down 30 ping pong balls in a jug of water, in a big bowl of water, all at the same time with your hands. They keep popping up all the time through the fingers, and it's really difficult to get them all at once. You need a kind of bigger glove to do it. And so that's how sort of juggling with these arousal systems works. I think that's the thing. And if one goes out of kilter, it tends to knock all the others off as well, because they're all interconnected. You know, that's the kind of neuro side of things. They're all heavily interconnected.
And on top of this, I think many people, I've been spoken to kind of friends and colleagues from the neurodivergent side of things, the added extra on, if it wasn't enough to kind of have to deal with these things, it's all the conformist normal pressures of how you should or shouldn't be behaving.
Yes.
And the conformist norms regarding kind of I don't know, civic norms and societal norms, and we can see the same with dogs, right? Because it's hard enough being a dog and having to kind of live by our rules and have us make all these choices for them. And the amazing thing is, many dogs, they kind of get through by that anyway, you know. But for some of these dogs, when there's already something else, a lot of other stuff that's already taking a lot of their focus, actually, regardless of the extra things we're expecting of them, again, it's setting them up to fail, isn't it?
Yes, it is. Yeah.
Well, we've got a few minutes left, Robert. That's been amazing today, and I think there's a lot that we can build on these things. Myra Bream, who did that study, do you know her? Do you have a connection to her?
I don't know her. I know of her. I know her study.
Okay.
It's one of the ones I pulled out.
Yeah.
So it's
She might be
2017. You'll find it on the internet.
she might be a good guest, maybe, to come and talk
Mhm.
about some of this. It might be a good guest if we could encourage
Yeah,
her to come
possibly.
and talk about these
Yeah,
things. But that's
possibly.
great. What would you like to leave us on, Robert, before we end up? What kind of points would you like to kind of either refresh us with about this talk, or important things that you want us to take home?
I think maybe a bit of speculation on my part. We don't talk much about side effects of medicine, particularly, but we do in humans because we all read the data sheets. But we tend not to so much in dogs. We might read the dog's data sheet, but it's one of the things I think we tend not to think about very much. But I think it's speculative to think that perhaps these highly sensitive dogs experience side effects more strongly. Not that that's a physiological effect, but again, because it's these interoceptive sensitivities going on of what the drug is doing to the body as the side effect. You know, if it's making you feel a little bit nauseous or a little bit spacey or whatever it happens to be, it might affect these dogs more. So I think maybe thinking about having conversations with the vet who's prescribing the medicine, see what kind of alternatives there are. There are certainly a wide range of formulations for analgesic medications to try. You know, some dogs are more sensitive to some particular products than others, and certainly from the literature and from speaking to many vets, they will switch medication if a dog has side effects on a particular product, a particular brand. I'm talking about pain meds here. If they have diarrhea or if they have gastro problems with it, switching to a different brand can often solve the problem. And this is one thing that the referral people do all the time. They don't assume that dog's going to be sensitive to all pain medications and therefore not use pain medications for a dog that's in pain, which is a big mistake.
Yeah.
The other thing maybe I'd like to make is a plea for those people who think that using prescription medicines should be kept to an absolute minimum because of side effects, etc., etc. I think that's really bad advice. I think that's a really bad idea. It's much better to take these meds and have some side effects and have the benefits of those meds than it is not to take those meds or to be lured into sort of untested or unproven complementary therapies and that sort of thing. I think our dogs are far too precious for that. I think it's absolutely fine for us humans to practice on ourselves with, you know, if one is dealing with a dog with some kind of chronic disease or particularly pain with alternative meds. But I think we owe dogs, the courtesy of at least giving them meds that we know work, that we've got the data work. And if one's going to use complementary medicines alongside that, then that's absolutely fine. But I don't think, particularly for pain, that complementary medicines should be used as the only kind of pain relief. Because in these highly sensitive dogs, that again is just going to compound their suffering and compound their welfare. And I think, you know, that's a completely unnecessary ill that we want to avoid.
Yeah, and a big takeaway again for us as professionals, but also caregivers in the group, is all this extra information that we learn and keep getting new bits that we think about. How important it is to advocate for our dogs and to data collect well for our dogs, to evidence-based well for our dogs, to feel that we can present that even to clinical people and say, look, this is what I'm seeing and this is what I've got, the pattern I've got. The vast majority of the vets I've worked with, they really value that. They value evidence basing, they value data collection, because then we have an idea, don't we, of what we're seeing rather than necessarily what we're feeling.
Yes, and I think one of the sad things about veterinary practice is that a lot of them have now been taken over by corporates, and a lot of the vets that I work with in rescue, I speak to a lot because all our volunteers have different vets. Is that every time they take the dog in, they see a different vet. And I think this is counterproductive. It's not the practice's fault. It's just the way they're structured. It's the management. It's the way they're structured. And I think that's such a shame because it breaks that continuity, that relationship between the vet and the client, the guardian and the dog. And you lose that. And what the vet is then relying on is then the clinical notes that have been written by the vet that saw the dog last. And so you've lost that contact, you've lost that continuity with it. And this is where I think we then rely too much on clinical tests rather than common sense, clinical intuition and guidance, and just knowing the dog. You know the dog, you know what the dog's problems are, you know the owner, you know the relationship.
Mm.
It's a kind of little village doctor, isn't it, that you always knew, and you know him by a surname and you see him down the pub. We don't kind of have that in veterinary practice, which I think is a terrible shame. There are still independent practices out there. You can still see the same vet, but it is quite difficult for a lot of people, I know. And I think that's sad.
And we see the same even in humans. I've had some health problems myself recently, and I've had to really pin down the practice and say, I want to see this doctor now, because I've got, I want to stick with one clinical lead.
Yeah.
And it's something that I recommend and try and do even with my clients. I will, if needs be, I'll contact the practice myself and I say, look, I need a clinical lead here because of the way, because it's quite a complex case. And you do have a few people that will be at that practice, invariably the kind of main people, and they're the ones to try and, if you're just seeing everyday stuff, I don't suppose it matters. But like you say, Robert, if you've got something that is potentially a bit complex and ongoing, to try and, have that clinical lead that you can add that continuity, and everything's more in context then, because you say, if you read some notes, it's not in context necessarily, you're just seeing some notes. But
you can never capture what you think about a dog in clinical notes, and you get to know the clients. The clients get to know the vet, and so you've got that personal relationship there, and the dog also knows the vet, and you have that relationship there, and so it just works so much more efficiently, and it leaves the window open, the door open for clinical intuition, and something which we humans is unique to us. It's not a clinical tool; it's an intuitive social tool, and you just don't get that if you don't have the continuity.
And actually, speaking to vet colleagues, they love these kind of cases if they can have that continuity, because
exactly.
A lot of your day is seeing dogs for 10 minutes, 10 minutes, 10 minutes. Especially, I'm seeing this dog. We're working through stuff. We're ruling this out, ruling that out. They quite like that process, I think.
Yeah, well, it's frustrating for the vets as well, because it takes away that clinical satisfaction you get. But as I say, it's a management problem. It's not a veterinary problem. It's a management problem, the way the practices are run. And it's a shame. It's a shame.
It is, but as I say, I think it's worth trying to see if you can get pinned down a clinical lead, because if you ask, you might get. You never know, rather than just see who you see on the day. Well, it's been amazing, Robert, as always. Amazing comments in the group. Thank you, everybody, for tuning in today. As always, Robert, thank you for being so generous with your time and your knowledge with us, and making it so accessible, because this is kind of quite deep stuff again, but you present in such a great accessible way. We're both presenting at Daniel Shaw's conference in November, so there's a lot of people in the group coming to that, Robert, so there'll be a bit of a dog-centered care posse there.
Excellent.
Just to let people know, on the 10th, we got Rachel Michaud that I was talking about. Rachel's an attachment expert for humans, but just through her own dogs has really started to join some of the dots there about parenting styles, and that'll be really interesting. We got Maya Rose on the 12th. She's coming in to talk about safeguarding, which is, as a professionals, it's an area that we don't get enough education on, actually, Robert. I think we need to know more about it. We got Victoria Cooper on the 18th. She's coming to talk about all things dog generally, but especially doodle mixes, because that's Victoria's kind of real interest there. And then on the 25th, we've got something a bit different. We're going to be horse-centered care with Ruth Evans, Jessie Sam, and Kate Thornton. And they're going to come and talk about horses, Robert. There's a lot of connection here between how we see behavior. I think the horse world might be even more behind us in the dog world, maybe. So I thought we'd give over a night for horses. Why not? And there's a lot of people here who've got doggies, but also have horses and have interest in horses. And so that'll be a nice, interesting one. We've got other things coming up, but that's as far as I've written down on my piece of paper. So thank you, everybody. Thank you for this evening. Thank you, Robert. Whatever you're doing, stay safe and look after each other.
Bye.